So, how this is going to work is I have been receiving during this week a lot of questions, so I'm going to answer those. But if you do have any questions, hi Katie, please make sure you write them down, and then I will reply to them and answer to them as we go on. So the first question that I've got here is, how can I get rid of age spots? So unfortunately, as we grow older and we get older, we start having age spots. Those are those brown marks that we have in our skin. The cells that cause those age spots, they're called melanocytes. And the best way we can do to get rid of them is by exfoliating the skin and brightening the skin on those areas. How can we do that? We can do that by using skincare that brightens the skin and suppresses those cells from producing that brown stain to the skin, and doing chemical peels and microneedling. So in clinic, it will be the two treatments that will be effective for your age spots. It will be the chemical peels and the microneedling, and at home you have to keep it up with your skincare to suppress those cells and to brighten the skin. But one of the most important things is actually to use sunscreen. That's what's going to prevent you from having those brown spots. So anyone that knows me knows how much I brag about skincare and especially the SPF. So is using an SPF, it's going to be your best friend to prevent lines and wrinkles and the brown spots. So next one is, I have seen you mention medical grade skincare. What does that mean? Right, so in the market you have kind of two types of skincare, the cosmeceuticals and the pharmaceutical ones. So the medical skincare means that that product goes through clinical trials to prove they are efficient doing what they say on the box, while the other ones, they can claim anything they want because they are not FDA approved, they're not regulated by anybody whatsoever. They can claim whatever they want. So medical skincare, it means it works basically. You will get the results from those products, or from what they state that they will help with. Right, we have some questions coming. Let me just scroll and see if I've missed anything. Perfect. So, right. So, if my skin is clean, free of makeup, should I use a micellar tonic solution before my serum? Great question. So I'm a firm believer that we should all double cleanse, especially if we use makeup, obviously. So I would use the micellar water to remove my makeup, and then I will use my cleanser to remove the rest. The reason being is micellar water is toxic to your skin. So you don't want to cleanse your skin, use your micellar water, and then apply your products, because, like I said, it will be toxic. And by doing the other way around, the micellar water also helps better to remove makeup because of the oils that it has in it. So what I would recommend, it will be micellar water, and then cleanse your face with a paraben and a sulfate-free cleanser, and then apply your serum. BB cream with SPF gives me enough protection. Right, great question. It's a question that I get asked a lot. BB creams, any makeup, moisturizers with SPF, they are great. but unfortunately they are not enough. They give you about 10-15 minute protection. So when you're looking at sun protection and protecting your skin, you should be using a separate physical broad spectrum SPF. It's the only way you're going to be protected, and you have to reapply it during the day in order to be efficient, or use, like I do use, SPF powder. Like today I'm wearing makeup, I'm not gonna, after putting my powders in, you know, the blush and everything, I'm not gonna put SPF again on my skin, so I have SPF powder that I apply throughout the day. Could you explain the treatment for someone that has too much underarm sweating? Lovely. This is one of actually of my favorite treatments. I personally have it done. So what it is we use botulinum toxin type A, which is a commercial name Botox, and what it does is suppresses the sweat glands and prevents you from sweating. So this treatment, it's very easy. It takes about 10 minutes to do, and it will last you between 4 and 6 months, and gives you that confidence. You don't have to worry about it. One of the reasons I decided to do it, I work very closely with people, as you know. I was very conscious if I was gonna smell or not, and that way I'm 100% sure that's not gonna happen. So to answer your question, it's very easy, straightforward. There's no side effects, nothing like that. Very popular for weddings as well, or any special events that people are concerned about the sweating, and meetings, you know, the bank, people that work in banks, you know, or having all those meetings. I do have quite some clients that come for that, and everyone that has it done comes back for it. It's a great treatment. Right, so let me just have a look here on my... I hope it's helping, and please let me know if you still have any questions even after I have replied to them. So I was just having a look here on the ones that were sent to me previously. Oh, another great one. What is the best age to start having treatments? Should I wait until I am in my 50s? Right, so there's no really a right answer to this. None of the treatments that I do have to be done. They need it to want, so people need to want to have them done. They don't. It's not a need, it's a want. So this means that there is no age that you should be doing. Now, if you're looking at preventing aging and lines and wrinkles, my recommendation always goes and starts with good skincare. Again, the medical grade skincare, that's how you should start. So you should start using a good skincare routine when you're about, I would say, 25, and as you approach 30, 35, that's when you start seeing your collagen depletion on your skin, and that's when you start seeing those fine lines and wrinkles. And only then I would recommend to have anything else, if you wish, obviously. Then we have, as you know, Botox, that it helps to the lines and wrinkles, mainly on your forehead, neck and décolleté, and then you can have fillers for your volume loss that start happening again when we are about 30. So the answer to this question is really the sooner you start, the easier you will be to maintain it. So if you start with a good skincare, and then you can have some tweaks, you can have some microneedling. If you're not really into injectables, you can have chemical peels, and all of that will help through your journey and help to improve the skin and the glow and the radiance. Because in my opinion, if you don't have a good skin, you shouldn't be having any injectable treatments anyway, because the outcome is never going to be great if your skin is not great. I hope that makes sense. Right. Oh, this comes from a friend, this one. How to get to an 8 steps skincare routine? And I do know why this question comes. For the people that have been following my social media for the last 2 weeks, I have been telling you about my skincare, and I do know I use a lot of products. It can be overwhelming. I'm not going to say that everyone should have an 8-step, 9-step skincare routine. Everyone's skin is different, and everyone's skin has different needs. So your skincare routine, first and foremost, is going to depend on that. I would always recommend someone that doesn't have any routine to start very simply with 3 products: cleanser, serum for hydration. I'm more about serums than moisturizers, and an SPF, and start building very slowly, because if you don't do anything and I give you a routine that's gonna take you 5 minutes to do, which is probably how long mine does, you're just not gonna do it. You're just gonna give up. So what I would say, start with the basic, and then very gently start building up and start putting your active ingredients like the vitamin C and the retinol. But to start with, most important, clean your face, because if you don't clean your face properly, the products are not gonna penetrate your skin. So you're gonna be spending money on a good skin care, and they're not gonna work if you don't cleanse it properly. So cleanse, then use a good serum that moisturizes your skin, and then your SPF, because that's going to protect you from the damage from the UV radiation, which is what causes the aging the most. After that, then you can start putting some good stuff in it. Yeah, right. Oh, this is an interesting one. How many times per week do you train? Right, that really depends. At the moment, I'm trying to do a little bit of exercise every day, but normally it's usually 2-3 times a week. When I started working in London, going to London sometimes 2-3 times a week, that wasn't possible. So I'm still trying actually to get a routine when it comes to exercise. But being at home has been great, because I have the time, and I've been able to do PE with Joe every morning. Not with my son, because he's not interested, so I do it on my own. Right. So another one that came through the questions on my stories is why there are so many fillers in the market. It is so confusing. Which one do I choose? Right, this is quite a broad question. Why there are so many? It's like with anything else. There's a lot of brands, and that's why there are so many in the market. It's a competitive market. The aesthetics industry is growing, so that's why there are so many in the market. Having said that, there are not many. They are FDA approved. Again, it has to do with safety, and been proven that they are good products, been through clinical trials and all that. So if you ask me brands, you're looking at Juvederm, Restylane, Teoxane, which is the one I tend to use in clinic, and Bellotero. So I think I haven't missed anyone. So these are the brands, they are FDA approved, and that means they have a safety record. They are more expensive than the other ones. Unfortunately, there is a black market when it comes to fillers. So when when I get my fillers, I always get it from the UK, from a UK pharmacy. I know they have been stored properly and they have been purchased directly to the factory. So that's also important. And that's why you may sometimes see a difference in prices when it comes to fillers. There is a lack of regulation in this country, and that's why we have so many, and so many are unregulated. Which one do I choose? I don't think, in my opinion, I don't think it should be the patient choosing the fillers. I think it should be the clinician. Whoever's doing the treatment for you, it should be the one choosing the filler, because they are the ones that have been trained for it. And every clinician has a preferred filler. So they are specialists when it comes to choose their own filler. If I have someone asking me to use a specific filler, if it's a filler that I am comfortable with, why not? But if it's a filler that I'm not comfortable, then I most likely will say no. Inside of the fillers brands, they have ranges, and we have to also make sure we're using the right filler for the right area. So that's why I don't think it should be the patient choosing the filler, but the clinician. Right. One more. Hi, Dr. Raquel Amado. Let's say I offer you an intervention on yourself. What would it be? Thank you for this question. I think it's great. So after this lockdown, I would definitely be needing some fillers. The last time I had my fillers done, it was in August last year. I can see they're wearing off a little bit now, and hopefully I'll be having them done as soon as we are back to normal. Are you taking bookings after lockdown? Yes, I am. So what I'm doing is I'm creating a list of patients, and as soon as I'm able to open the clinic, I personally contact everyone and book them in. In the meantime, if you wish, I'm doing online consultations, so please feel free to drop me a message, private message with your name, contact number, email address, and then you can either decide if you want to go for online consultation or if you prefer to wait and see me in person. Any questions here? Anything? Hi, Patricia. I just saw you. Right, so how about filler? Get free of the nasal label line. Right. So suspect you're asking, Maria, between this line here. So this is actually one of the treatments that I get asked a lot, and the reason why this is one of the areas we find that they first show SVH, and the reason is we get bone reabsorption as we age. We have fat pads underneath our skin. They shrink and they descend, with the exception of this one here, which is the one that gets bigger, and our maxilla also recedes, and all of these factors are the ones that cause the lines and the shadows that we see in our face. So this is a very, very good treatment. I tend, and because of the recession, the aging process that I just explained to you, I don't go and feel the fall directly. That's when you see those cases, they look unnatural and they look odd. So we'll have to replace what has been lost and restored in when we're talking about aging. So if I'm just going to show you, if I do this, can you see what it does to my line, nose to mouth line? So in my case, for example, if I was treating myself, I would put a tiny little bit of filler on my cheeks. This will give me traction, and it's going to give me support of my soft tissues in this area. I will also probably put a tiny little bit here, although I'm quite plump here, and a little bit on the side of the nose. And only then, if I was still not happy with it, then I'll go and fill a little bit the line directly. But if we don't do this, that's when you have sausages and very odd in looking results. I struggle with acne prone skin since my teenage years. Oh, I can't see the whole. Okay, sorry, here we go. I struggle with acne prone skin since my teenage years. What products would you recommend? So I don't know if you are aware, but I mainly work with Lumia. So acne, I know how stressful can it be to have acne skin, and there are a series of things that you can be doing to improve that. Using a cleanser specific for acne, it really helps. Lactic salicylic acid is one of the great things to use for acne prone skin, because it has an anti-inflammatory effect and it also an antibacterial effect, and that's what we want when we have acne skin. A little bit of exfoliation, retinol, anything that helps to remove the dead skins and to let your skin breathe. Having said that, there are different stages of skin of acne, and depending on which stage of the acne you are, we might be able to help with other things. Chemical peels are amazing for acne. So what I'll probably recommend, obviously without seeing you, it would be a cleanser specific for acne, probably 2-3 times a week. We don't want to use it too much because it can dry the skin, and it's always a fine balance. And then use a serum specific for acne, a very, very light moisturizer to make sure we're still getting and we're not losing all the water from your skin, and the SPF. The SPF, again, is going to be your best friend. So I hope that helped. How do you choose a good sunscreen? I think I touched on this question a little bit later on. So when you're looking for a sunscreen, you're looking for a physical sunscreen. How do you know that? Zinc oxide, titanium dioxide. So these are two ingredients that you will have to look at the packaging. And you want a broad spectrum, meaning it's going to protect you from UVAs and UVBs. And you should be wearing one every single day. Sunny days, cloudy days, rainy days, it doesn't really matter, because we will always have UV radiation. Regarding the SPF again, I love SPF, so I'll keep asking me things about SPF. Regarding to the SPF again, when we should apply it, after or before daily cream? After. So how you use your SPF, you do your full skin routine, and at the end you do your SPF, and then you do your makeup. So you can, in these days, SPFs before, they used to be horrible, the physical ones. They used to be very white, like the surfers you would use. These days you can get tinted ones, like the one I use, the one that I have today on my skin. And sometimes, if your skin is good, you will be able to get just using the tinted SPF like I do. So yes, after your moisturizer, before your makeup. Welcome. Dr. Raquel, I have followed your videos about your skincare routine. If we can't buy the full range, what would you recommend as the essential ones? Right, so like I said before, cleanser. Again, with the clean science, no parabens, no sulfates. So there's something that I'm very passionate about, is not to use any toxins in the products. Good cleanser. good hydration serum and your SPF during the day. In the evening, cleansing, again, a good hydration serum, and if you can, a retinol. That will be my recommendation. Ah, nice. I have a Portuguese question here. How long does it last, a Botox treatment to remove dynamic lines? So it lasts about 3 months. It depends a little bit on your metabolism. So on average, it will be 3 months. If your metabolism is quite fast, you'll tend to find that it won't last as long. That happens, for example, with my husband. He metabolizes things a bit more quickly. In my case, it might last a tiny little bit more because unfortunately my metabolism is a bit slower. So it depends, but on average, 3 months. It takes about 5 weeks to peak, to work at its top, and then at 6 weeks it gradually starts wearing off, and it completely wears off between 3 and 4 months. Oh, Daniela, why serums better? Right. So the way the serums are done, they usually have smaller molecules of the products in order to penetrate the skin. And they're usually the ones that have active ingredients that are going to help with a specific cause, fine lines and wrinkles, brightening the skin with acne. And the moisturizer, I suspect the question comes because of the difference between serums and moisturizers. That's a question that I get asked a lot. The moisturizers, the only thing they do is they trap the water on your skin. They don't let that water evaporate from your skin, that hydration that we have. While the serums feed the skin with those active ingredients to help with hydration, whatever the cause is. So I don't use a moisturizer. I do have one in case I feel my skin needs one, but it's really rare when I use it. Serums, because they are the ones with the active ingredients. Oh, thank you, Sarah. Oh, thank you. What is your miracle recipe to have a perfect skin like yours? So, perseverance, I would say. Routine. Is using the right products for your skin, not using any toxics. Try to drink 2 liters of water a day, which in the winter is difficult. So no sunshine, no. Like we like to stay in the sun, so avoid as much as you can be under the sun. Use a hat, use sunglasses, use your SPF. We do need our vitamin D, so I'm not saying don't be in the sun, but just try to at least protect your face, your neck. What else? And then use your active ingredients. I think the heroes of my skin care routine are the vitamin C, the retinol, and the AGE serum that I talk about is the one that protects about glycation and pollution. I think these are my 3 secrets for my skincare, and in doing it every day, morning, evening. Like I usually say to my patients, and whoever knows me knows that I always use this analogy. I am a dentist, as you know, and if you go to your dentist to have your treatments, but you don't brush your teeth in the morning and in the evening, you're going to get decays or you're going to get gum disease. So it's exactly the same thing. If you do your skincare routine in the morning and in the evening, then you just need to come to me for the little tweaks. But it's you at home that does the biggest job. winter protector must have the same characteristics as the summer protector. Yes, exactly the same. You could potentially use a little bit less factor, but to be honest, the difference between a 50 and a 30 is not that much. It's about 10% difference, and we really want to try to block those UVAs from our skin. So I use exactly the same thing in the summer, in the winter. Right, so let me just go back here to my questions. How long is it? How old? Oh, half an hour. Good. Because Instagram will kick me out if I spend too much time here. So, is microneedling good for any type of skin? How soon do you see results? Right, so microneedling, there are some patients that can't have microneedling. If severe acne, because we don't want to spread that infection on your skin, and some types of rosacea as well. So those will be the two kinds of skin that can't have microneedling. Everyone else can. It's an amazing treatment. I love it. If you have seen my videos, I do that quite frequently. Results depending what you're looking for and the quality of your skin at the time that you started treatments. I always say between 3 and 6 to see good results. If you are trying to improve stretch marks, acne scar marks, that can take a little bit longer. That can take up to 9 sessions to see full results. You will see results after the first one, especially anti-aging, but you really start seeing greater results after 3 sessions because your collagen is being stimulated. And then after that course, then the recommendation is every 2-3 months to maintain, because unfortunately we keep aging. That doesn't go away, unfortunately. That's for us for the rest of our lives, and it's like a little bit of a boost, and then you can combine with other treatments, but it's a great treatment overall. I love it. Do fillers hurt? So the question is no. I had them done personally. And they have, so the filler itself has lidocaine, which is an anesthetic. So you feel the needle going in, but because of the nerve structures and where everything is in the face, they are not painful. The only place that I would say it's uncomfortable, it will be the lips. It's a very, very sensitive area, and it's the only place I use topical anesthetic 20 minutes before the procedure. And I use a special one that comes from Portugal that a friend of mine got it for me, which is a bit more effective than the ones that we can get in the UK. I tried that on her, and the feedback that I've got is it really works. It really makes a difference. So from all the treatments that I perform, I would say lips, it's the one that it's a bit more uncomfortable. Everywhere else, absolutely fine. My skin is very clear. What extra concerns should I have? None. Again, if you're trying to prevent aging, I would probably add a retinol to your routine, and that's it. We don't have to overcomplicate things at the end of the day. If you're happy with your skin, it means you're giving your skin what it needs, or it naturally has what it needs. You can just help out and boost a little bit the cell turnover, in this case with the retinol, just to prevent the lines and wrinkles. But if you use your SPF on a daily basis, I'm not sure how old you are, but it will help you a lot. Hi Vanessa. So why is the Lumiere only SPF 40? I really need at least at factor 50 as I get pigmentation. Right, so like I was explaining a couple of minutes ago, the big difference is in between a chemical and a physical SPF. The difference between a factor 50 and a factor 40 is about 5% coverage. It doesn't protect you much more by being 50, and that's why you sometimes see 100 on the shelves. And if you see and if you compare the protection that one gives against the other, it's a very, very small percentage. So what you're really looking at, anything over 30 that is a physical SPF, broad spectrum, again, protecting you from UVAs and UVBs, that's what you want to prevent your pigmentation. And besides, all the products that we talked about to suppress the cells that produce that melanin, the brown spots, and another one to brighten the skin. So with those 3 products, and the vitamin C I was forgetting, because the vitamin has a great power of brightening the skin and also protecting from the UV radiation. You can also, for your pigmentation, use Skin Aid together with A Defense, and together they work preventing pigmentation. I hope that helped, Vanessa. Right, so should we use moisturizing after serum? The answer is, depending which serums are you using, because you have different serums for different things. If you are using a hydration serum and your skin looks hydrated, the answer is no, you don't have to. You'll have to see how your skin is reacting to those serums, and if they are enough, you don't have to use any moisturizer. Like I said, I personally don't use one. Oops. Thank you. Be omega.